But let's get over to Dr. David Winter while we have him from Baylor Scott and White Health, because we got a lot of questions for you this morning. Hi, Dr. Winter. I'm so happy to see you.
Hey, Sonia. Hope you're doing well. Hope you're safe.
Thank you. Yes, thankfully. So far, so good. So what has it been like getting back to sort of work, back into the swing of things as far as your colleagues? I know that a lot of these elective procedure restrictions have been lifted. So what does it look like in the hospitals now?
Well, Sonia, we haven't had elective procedures since March the 12th. We have a backlog of 5,000 cases, I'm told. We just opened up today. And so we're excited about this. But first, it's important to know we're doing this very, very safely. Everyone coming in for surgery must have a COVID test. We do that for them. Also, we have virtual waiting rooms, so family and friends can keep in touch with video chats. We have a no-touch registration process, so no papers to shuffle, no papers to sign. And we're going to require everyone to wear a mask. So if you come to an operating room or come to a hospital, come to a clinic, if you don't have a mask, we're going to give you one because we want everybody to be safe, including the healthcare workers.
Okay, so you said that you give everyone a COVID test. Is that mandated? And then also, how long will it take for those people to get their results back?
Yes, we're going to do the test a day or two before, and they'll be back in time for surgery. We'll ask the folks, of course, to quarantine during that period so they don't get exposed to anything. We've been doing this actually for a couple days now, and it looks like it's working very, very well. So it's the viral test we're doing, not the antibody test. The viral test is the one you get through a swab or through your nose or your mouth or with this new saliva test. That tests for the virus itself.
I'm so glad that you mentioned the antibody test. I have a lot of questions coming in from viewers about that. I saw in the New York Times earlier, I think it was actually last week, 3 out of the 14 are deemed to be, accurate, or, they said that they had consistent accuracy. So if someone does want to get an antibody test, and I don't even know if that's widely available here yet in Texas, can they, number one? And number two, how do you know that you're getting a test that's accurate?
Well, that's so important to ask that question. There are lots of antibody tests out there. 90 companies are making these. Only 3 or 4 have been approved by the FDA. The ones that aren't approved yet, some are good, some are horrible. You don't know what you're actually getting right now. But let's talk about what that actually is. This is not testing for the virus. It's testing your body's response to the virus. So when a virus enters your body, in this case the coronavirus, your immune system turns on and manufactures antibodies to attack the virus. We're measuring those antibodies. Now, does that mean that you got the virus now? Not necessarily. It means you had it in the past. Probably. Does that mean you're immune? We don't know the answer to those questions. So the antibody test is still a conundrum now. We think it's important for population studies, but for one individual person, we're not sure what to make of that. For going to surgery, we want to make sure you don't have the virus. So we're testing for the virus itself, not the antibody.
Yeah, that's an important distinction to make. The diagnostic test looks at whether you have the virus, and the antibody test presumably looks at whether you had it. So if somebody is going out to get this antibody test, and I've seen, advertisements for this up to $225 on Instagram, what is the proper question people need to ask before they're spending this money to determine whether or not to take this test?
Yeah, ask what machine this is being done on. And actually, I would actually look up on the internet, see what are the machines that have been approved by the FDA. Those are the ones you want to make sure are doing the test, not some company that hasn't been approved by the FDA. Now, this is very important though, Sonia. If you get a test back and it's positive and you're healthy, okay, you were exposed to the virus, you built up antibodies, that does not necessarily mean that you're immune, so you still need to physically distance, wear a mask in public, and wash or disinfect your hands. A positive antibody test does not mean you can relax the rules right now because the virus is still out there, and the antibody doesn't necessarily mean that you're immune to it.
That's a great point. And are you or will you give your patients this antibody test?
If they want the test, I'm going to give it to them, but I'm going to tell them the same thing I just mentioned. I'm not sure what it actually means right now. It's important for populations. For one person, I don't know that it means a whole lot. So it's confusing information right now. Ask me next week. We may know more. This story keeps evolving. We keep learning more about this virus and the testing, but as of today, we're not sure what an antibody test actually means for an individual person.
Dr. Winter, I hope we can chat next week and maybe technology will play along a little bit better for us. Although, hey, I'm glad we got to talk today. Thank you so much for your insight as always.
Thank you.